This is Perspectivas Latinas, a community service of CAN TV. I'm Juan Carlos Hernandez. Our guests are from the Illinois Hispanic Nurses Association. They're here to talk about empowering Latinas and Latinos in the field of nursing, but also how they seek to serve the community. Welcome to both of you.
Thank you.
And our first guest is Susana Gonzalez. Welcome. Let's start with you. Tell us about yourself and how long you've been in nursing.
My name is Susana Gonzalez, and I'm the president of the Illinois Hispanic Nurses Association, and we're a member of the National Association of Hispanic Nurses. And I've been a nurse for a few decades already.
A few decades. Okay, well, very quickly, what inspired you to go into nursing?
You know, somewhere in childhood, you kind of feel the passion of caring for individuals. And we grew up very poor in our community, but I was always sort of like, even as a child, the resource person, the go-to person, the person who was gentle, the person who healed people, the person who listened, the person who touched, and somewhere along the path, it led me to nursing.
Well, we'll definitely hear a little more about that as we talk. Our second guest is Evelyn Gomez. Welcome.
Yes.
And you are not you're not a nurse just yet, right?
Not yet.
So,
Yeah.
but tell us about what made you come into this profession and why you're part of Illinois Hispanic Nurses Association.
Okay. So my name is Evelyn Gomez. I am currently a student at Rush University. I joined IHNA about a year ago. I've been involved with them ever since then. As far as passion for nursing, again, childhood experience, but I just saw an opportunity to change the face of nursing, and that's what I want to do. I want to help minorities get into the field of nursing.
Okay, so yeah, let's talk about that. Why does this organization exist, Illinois Hispanic Nurses Association, and why is it part of this larger National Association of Hispanic Nurses? Susana, tell us about that.
The National Association of Hispanic Nurses came to be in the 70s. I think it was sort of like an offspring from the American Organization of Nurse Executives and ANA, you know, the American Nurses Association. And again, just, you know, as Evelyn is saying, there's a need to have a cohesive group. There's a need for support. Mentoring and avenues and pathways that can be open, which sometimes happens in professional organizations. So the National Association of Hispanic Nurses is a professional nursing organization that's commitment and its mission, vision, and values are to enhance the healthcare community and the profession of the nurses that are bilingual and bicultural in this country. And then Illinois Hispanic Nurses Association is obviously the chapter, right? We're a state, and we strive for the same at a local level. So our nurses, our members, our students are seeking nursing, or our nurses from various degrees, various professions, and we're supporting each other as a network to continue to aspire and inspire others to help the healthcare needs of this country.
Okay, what do you mean by various degrees and various professions? Just touch on that lightly, because I know we spoke about that a little bit before the show, but just so some viewers that might have, who aren't nurses and might be interested in the profession, just so they have an idea.
So we have nurses that are licensed practical nurses. We have nurses that have entered nursing in a 2-year program, so they're educated and trained at a associate's degree level. And you have your baccalaureates, you have masters, you have DNPs, doctorates, and PhDs. We have family nurse practitioners. We're so proud at the Illinois Hispanic Nurses of the number of advanced practice nurses that can help serve our population in this city and in this state, hopefully in the future as well. So that's what I mean. And also profession of, are you an intensive care nurse? Are you an ED nurse, an emergency or psych nurse, a mother-baby nurse, a peds nurse? There's so many specialties, home health, community health that you can go into.
Wow, it sounds like quite a network. And Evelyn, and you decided to become part of this network. What drew you to it? And you said something interesting, change the face of nursing. Tell me about how that works as a part of this organization, and how you've seen yourself become a bigger part of it.
So, yeah, as I mentioned,
Several questions there, sorry.
no, I'll go one by one. So as I mentioned, I joined IHNA a year ago. I actually attended the first meeting and they spoke about their mission. And it aligned with my mission, and that's to increase diversity and help the other generation of nurses that are coming before us. And so what I mean about changing the face of nursing is seeing more nurses, and I'm talking about diversity in the nursing field, so just different backgrounds, different cultures, so they could be culturally competent when they are taking care of patients.
So, changing that for the face of nursing, is there a lack of Hispanic nurses,
Yes, there is.
Spanish-speaking, bilingual, bicultural nurses? Susana, your eyes widened.
Wow. I think in this nation, there's way over 3.3 or 3.7 million nurses in the USA. And I think what happens is that when you look at the number of diversity in this nation, as we're saying, and we're looking at diversity for me and for Evelyn and our membership from a Hispanic point of view. You know, you got almost 53 million people that are Spanish descent or Spanish speaking in this culture, in this nation. And we want to help represent them and take care of them in a healthcare area. And I mean, nationwide, there, you know, if there's 150,000 nurses that are Hispanic, bilingual, English, Spanish, it would be a lot.
Really?
So it's poquito. So we really want to be part of the decision and the healthcare. And yeah, changing the face of nursing is everyone's goal. You know, everybody needs to strive to do that. There isn't one organization that isn't talking diversity. There isn't one institution in this world that isn't talking diversity. You know, so how do you mirror the populations that you're taking care of if you don't inspire others to aspire to help?
But is that something recent? Because I'm sure, I don't know, well, I can't be sure, but I imagine that some people might say, what
We've
does
always been doing that, right?
Yeah, what does it matter who is serving these sick folks or these people in need? I'm sure you've come across some, well, I imagine you've come across some of that attitude in your own work throughout the decades. But now you're saying it's becoming a topic of discussion, or a much larger topic of discussion. How do you respond to that type of question or idea?
There's a lot of research that's been done, and obviously, no one says that you cannot take care of, you know, non-English speaking patients by someone that isn't Spanish speaking. Always happened, has always had. And if you've seen the Western culture and the medicine, the outcomes, we've struggled with them, right? So one of the things that needs to happen, and we believe, because a lot of the literature and a lot of the studies and everything that's happened shows that when you have culturally competent healthcare, where people understand and value the culture of the individuals you're giving care to, the outcomes should improve. Okay, and we've seen that. I've seen that because I'm a veteran in nursing, and someone as young as Evelyn sees that even today. So we've been striving for it, but I think there's more of a genuine attempt to commit to change that face.
Okay, so Evelyn, tell me about that genuine attempt. What are you doing specifically to help? You're not a nurse just yet, but you're obviously involved in trying to build up the number of Hispanic nurses here in Illinois. How does it look in your everyday work?
So as a student, I have seen like that side, and so what I did was partner up with IHNA. So I am doing a program called LEAD, which stands for Leadership, Education, and Development at Instituto del Progreso Latino. And so what I do there is I mentor the students and I provide them with health education. So the mentors come from IHNA, who have been in the field for quite some time. So they're able to kind of get that advice, guidance, support from the mentors in IHNA. So I'm very involved with the community because I do see that high school students need those mentors. I mean, when I had a mentor in graduate school, it helped a lot. And so I see that that's an opportunity to help high school students kind of become the next leaders of the nurse.
And what are the questions, doubts, fears, points of curiosity that these high school students have about nursing? What are you encountering?
So I had actually a workshop where we talk about the different pathways of nursing. So something that they're curious about is, how do I become a BSN? How do I become a MSN? How do I become a family nurse practitioner? So just learning the different pathways, because nursing has many pathways. I mean, you could go into public, you can go into policies, you can go into different specialties. So they're really curious as to, how do I get there?
So it's not just the bedside, right?
Right.
It's not just a bedside.
And when you tell them there are all these avenues, what response do you get from these young folks?
So they're a little confused. They ask a lot of questions, and I try to guide them in the right direction. But yeah, there's a lot of questioning as to, I still don't get it. So I have to explain it in a different approach. But
Have you specifically built a relationship with a person that you've helped mentor into the profession or into school?
so I have quite some mentors.
Yeah.
I have about 5.
Right.
So some of them were kind of through organizations, and others were just built in relationships that they just decided to help me.
Awesome. Now, do you, Susanna, you mentioned a term that I think we don't often discuss when people say diversity. I don't think they think about the depth of that term, or what other terms should be attached to it. Because you said culturally competent. What does that mean, and how does your organization aim to make sure that's something that it's part of the discussion and part of the training?
At the National Association of Hispanic Nurses, if you go on its website, and anyone can in the audience as well, just search for the National Association of Hispanic Nurses, and you'll see their website that comes up. One of the things that is done is there's a special program that's called role modeling, right? And this is where we're working. We have a grant. And the grant at the national level is to diversify nursing and strengthen its cultural competency by seeking Spanish-speaking individuals that want to seek nursing. So there's all individuals' roads and pathways, as Evelyn says, towards nursing. And our goal is to continue to increase the number of the bilingual Spanish-speaking nurse. And we have men nursing. We have such a great, our presidents at the non-level, our immediate past president and our current president are men nursing. So diversity is about men in nursing. Diversity is also about different cultures. And I know we aim at the Hispanic culture, but other organizations focus on the Chinese culture, the Vietnamese culture, and the African American culture, and enhancing those providers to give that special touch of that competency that we think we have for our patients.
By special touch, give me some examples, because I just think about family that I've visited in the hospital, and how difficult sometimes it's been for them with Spanish, and us having to serve as translators, and it was just a communications gap to navigate, and not just the communications, but the understanding.
Right.
But you would tell me, in your own experience, because you have so much experience serving, how do we see that, and how have you responded? Because you said Spanish speaking, but I don't think it's just Spanish speaking.
No, it's not just Spanish speaking. Yeah,
Right.
you're right. It's about the culture. A thing that comes really quick to mind would be with our diets and our diabetics. And language is huge. That's why
Right.
hospitals with more than 5%, or any entity that's taking care of someone in healthcare with more than 5% of one particular language, they should provide care to them in that person or persons' language. That's what many hospitals, and that's what the federal government strives for. That's why we got language laws and things like that, and you got interpreters and institutions, and everyone's trying to learn culture, and everyone's trying to understand and value what they bring to the table. But sometimes in a couple decades ago, I would even think of the diet. You have Spanish-speaking patients, and we eat different foods. And here comes an ADA, American Diabetic Association diet, that has different things of what a mom, I say mom because I'm in women's health, of a patient's going to eat, and have a short window of time. And for us, it's like, this is what you need to eat, and this is how you need to eat it, and this is why you need to eat it. And the patient sits there, doesn't understand why, and then we wonder why they're non-compliant. Well, why can't
that's
this
a
person
term.
get well?
Okay.
We hear that a lot in our, in places, or, that's
Okay.
why we do a lot of stuff in the community,
Yeah.
right? We do presentations and education and outreach and awareness.
So tell me about that, what you do out in the community, because it's, and I do definitely want to talk about the networking and events you have and how you build each other as a community, but for the community that's out in our community that isn't part of the profession, tell us about that.
I want to talk about Vive tu Vida. You guys just finished
Yeah.
that with Nancy and our
Tell me
members.
about that.
So Vive tu Vida, it's kind of like a health fair, and so I brought the students with me. So they were all in kind of like a table, kind of teaching about the different. We had My Plate, so we had a lot of people come to our stations where we kind of explain about the different things you should be eating and all that stuff. And then we also had kind of like as far as like beverages, how many servings should you be having, so just nutrition labels. So we did that, and there was a lot of actually IHNA members that went, and also
This
lead
is a
members.
Muévete USA project. So
What is
it
that?
is-
What is it?
The Muévete USA is totally focused on the young child and its mother and father, the family, about healthy eating, increasing
moving,
activity,
right?
and moving,
Muévete,
increasing activity.
move.
We had Zumbando en el Barrio
Okay.
with AARP. So as IHNA, we collaborate with these other organizations. And Muévete is a small piece, and one of our nurses is the leader of Muévete USA. So you got the kids enthused about moving, and you talk about self-esteem, and the booths had students from IDPL, because we love our association with the Institute of IDPL, the Institute del Progreso Latino, the Health Careers Academy. That's our target, those kids, right? And how we can collaborate and work together. So all the members, many of the IHNA members were there, and the students were there, and they paired up together. So there were different booths and information and education and outreach. And I think what was really exciting that I heard from the members was that the involvement of the mom and the dad and the kids, and the kids talking to them about taking an oath about sweetened drinks and doing more water than more sodas. Disrespect to the sodas, but light, everything in moderation would be so much better for all of us.
Like us getting pop for you today, just a little bit instead of water.
Just a teeny bit, un poquito.
No, so and these type of events, you hold them out in the community. That's one of them. Muévete. What else? Tell me about other events you've been a part of.
So we have March of Dimes.
Yes.
Okay.
Yes.
And you collaborate with this organization? Or?
So Suzanne can
Yes.
speak. Yeah, but we do collaborate with
Yes,
them.
we're so focused on prematurity, and Celebrando la Mujer Latina was a small segment of it before. I mean, I just got off the phone earlier, and I don't know if I can plug that in, but Celebra Mujer is something that Hoy is going to do, and we're going to help with that. And we want to do health screenings. We want to do the collaboration that we have with the American Heart Association. And again, Evelyn's one of our members. I'm a member. There's another member that's the collaborative link for the American Heart Association, right? She'll lead us to do health fair screenings, do blood pressure awareness and education, talk about cardiovascular disease in our Latino community, and how can we have healthier hearts, right? With the March of Dimes, we want to talk about childbearing moms. We want healthier babies. So we want to tell you about the birth outcomes in the Hispanic population, and what does it do to us if we're having babies too early. So it's that involvement, and it's the enthusiasm. I call them champions. She's a champion, Liz is a champion, Nancy's, all of us have passions and values that we want to lead and to collaborate with our other sisters and brothers in the organization to do community outreach and to empower our communities.
Yeah, definitely. And it sounds like you're making all these linkages, right? You're
Yeah.
just connecting all these people. So it's not just about nurses and empowering nurses, but also informing and empowering the community,
Yeah.
right? Now, I do want to go back to the nursing community. How specifically do you support each other once you're, well, as students, I heard some of that, the mentoring, the support of bringing people along, answering questions. But once you're in the profession, I think it becomes a different, right? There are other things that happen. You're no longer a student, you're working full time and forming families. How does that connection between nurses remain, and how do you keep it strong?
I think every organization wants to continue to it's like a stepping stone kind of say, right? And we need that social network, we need that bonding time. So even if it's once a month, it's about coming out and supporting one another, that you're an ICU nurse or you're working in the emergency department or you're a psych nurse. It's about the value of what we do as a profession and to support that avenue. Nurses will come and say, is there anyone looking for, I'm looking for a job, and other nurses might come and say, at the institution, word of mouth is good, right? Come work at Rush. You know, I work at Rush, or come work at my institution at U of I or UIC or Northwestern. I don't need to brag about them, but community health hospitals, Norwegian, we have members in every facet. They're in nursing. And nurses have to support nurses. Sometimes when you get out there, it's reality shock and you're like, OMG, I'm not Florence Nightingale and I can't save the world. But you know what? We have to support each other.
Right.
That si se puede, and we can try. And that's, I think, what we try to do. It's a social support. We're giving scholarships to other students and other nurses that want to, you know, do more, and that kind of stuff.
And talking about support briefly, because I know this topic is more complex than we have time for here. Nurses coming from Latin America and Puerto Rico, I know they face particular challenges in trying to get the ability to practice here. So just tell us briefly about who they can turn to, or how, if they've turned to you. I'm sure that you've had questions before.
What we do is we work really hard with the Chicago Bilingual Nurse Consortium, and internationally educated nurses are a specialty and a breed among themselves, and they have real challenges and barriers that are different from the you know, the nurses or the students born and raised here. So when a nurse comes from Puerto Rico who's being challenged today as an internationally educated nurse, when they're not, they're the Commonwealth of, you know, the USA, and they can come here and work in the VA, for example, equal to equal. They all train and educate as a BSN over there, and then now today we're having these issues. So the Chicago Bilingual Nurse Consortium is a phenomenal organization that is totally dedicated to IENs and the specialty needs of training and educating in other countries and transcribing those transcripts into Illinois. So that's what I would say.
That's
That's right.
Yeah.
Yeah, because they have, like you said, their own particular barriers that you can't necessarily respond to, but you can direct them in the right direction. We're getting close to the end of the show. I'm curious as to, because you are a network and support system, what do you say to some young Latina or Latino out there that is thinking about going into nursing and but has some doubts and fears which come along naturally? Evelyn, what would you say to them?
Yeah, so I would say first off that anything is possible. I mean, wouldn't, you know, like, yeah, we do face some barriers as Hispanics and minorities, but as long as we keep pushing and every time we fall, we stand up, it's possible. And I think one way is to break barriers is education. So the more education they have, the more change you could make in the world.
And the support system, obviously, of like your organization.
Yeah.
Absolutely.
And yeah, get involved with IHNA, get involved with organizations that are willing to help you and willing to guide you in the right path. I mean, we all have some questions, and just getting the help will definitely make the difference.
Yeah.
Okay, what would you say, Susana? Or what? Or
I wear my passion for nursing always on my sleeve. I've always, you know, since I was, you know, a novice nurse. So I think nursing is a really, really important profession today. It really is. It is the main navigator of the healthcare system. And that's what we want to do. And the more education, I think that's important. And that's what we really should encourage. That sí se puede. That, yeah, we can too. And if you want to sit at the decision-making table and you want to help policy and you want to advocate on behalf of your specialty, whether it's women or health or psych or, you know, any of the areas of nursing, home care, community health, all of them need bilingual, bicultural, Spanish-speaking nurses, and we want to help.
great, great. Well, we're out of time, but thanks so much for coming today and telling us about all that you do.
Thank you.
Awesome.
And to you, thank you for joining us. Perspectivas Latinas is a community service of CAN TV. If your nonprofit organization would like to work with CAN TV, call 312-738-1400 and ask for nonprofit services. Tune into Perspectivas Latinas for local issues and concerns every Thursday at 8:30 p.m. on CAN TV 21. I'm Juan Carlos Hernandez. Thank you for joining us.